I hereby open this academic ceremony in which Claudia Behrens Pérez will defend the academic thesis Medical Students' Emotions in Complex Simulation. Before we go to the actual defense, I would like to introduce some of the people here. All the opponents will be introduced when they get the floor. But I would like to present to you the supervisory team, which is Professor Diana Dolmans. She's a professor of educational sciences at Maastricht University. Professor Erik Driessen, professor of medical education at our university. And Professor Gary Gormley, Jerry probably, huh? Clinical Professor, School of Medicine, Dentistry and Biomedical Sciences at Queen's University, Belfast in Northern Ireland. We're very proud to have you here. And then I would like to ask you to, first I'll introduce myself. My name is Nanne de Vries. I'm an emeritus professor of this university, replacing the rector today. And now I give the floor to you for a summary of your work.
Okay, thank you very much. Good afternoon, dear prorector, supervisors, member of the committee. In the next 15 minutes, I will provide you an overview of my study called Medical Students' Emotion in Complex Simulation. As introduction, I can say that all-round skills are essential for doctors who work in hospital settings, especially in emergency departments. This represents a key activity that brings an organized process to interact with patients and guide the clinical care. All-round skills integrate a range of clinical tasks, including technical and not technical skills, such as communication skill, patient management, between others. But evidence suggests that medical students and even junior doctors are not fully prepared to perform in this kind of settings. Here we can see a picture that reflects a typical emergency all-round and its complexity. Simulation-based education has the potential to be an effective learning tool that brings opportunity to our students to practice and save in a safe environment, practice and learn in a safe environment. In the last year, a specific kind of simulation called all-round simulation has emerged in order to best prepare students for this critical duty. All-round consists in complex clinical scenarios in where students have to manage different patients at the same time. They have to interact with them, with relatives, with other members of the healthcare team, make decisions, and deal with distraction, noise, interruption, etc. Thus, all-round simulation offers a realistic environment to train this kind of skill in our students. However, immersive simulation, such as all-round simulation, are complex learning environments and can place high demand of learners' cognitive resources and can evoke a range of emotional responses in our students that have the potential to overburden learners and hinder the learning. So, in my research, one of the theories that I used was cognitive load theory, because the complexity of this kind of simulation, we know that intrinsic cognitive load arises from the cognitive process that is directly related to the task, and extraneous cognitive load results from the cognitive process that is not directly related with the task and don't contribute learning. And we weren't sure if this kind of complex simulation wasn't not suitable for our students, and maybe this complex learning environment could increase the extraneous cognitive load. Another theory that we used in our work was control value theory of achievement emotion. This theory makes some relationship between emotion that the student experience in academic context and learning. For instance, we can see there different positive and negative emotions. For example, pride, that is considered a positive emotion, with high psychological arousal for the student could be related with more possibility to learn because it encouraged the cognitive process and motivation. So my research program was built in 4 studies. After to start to see what kind of emotion can emerge in this kind of simulation, we needed to be sure that this kind of complex simulation was suitable to be used in undergraduate medical students. So this was the first study, and the next 3 studies were made about emotions from the students and a facilitator's perspective. This was the first study in where we needed to know if it's possible to use this kind of complex simulation for undergraduate medical students. So we measured cognitive load, we measured performance, and made some individualist interviews. And what we found, students have deficiency in one-round skills. But the important thing is that the intrinsic cognitive load was moderated and the extraneous cognitive load was low. So we could determine that this kind of simulation was suitable to be used in undergraduate medical students. But also, qualitative findings give us important insight about how this kind of complex simulation can support learning. For example, well-designed clinical scenarios, the possibility to make decisions and prioritization tasks were seen as a factor that can support learning, whereas distraction and noise were seen as a factor that can impair learning. However, students claim that those factors should be included in the instructional design because distraction, noise are part of the real practical clinical practice, so they need to be trained to deal with that. So after to know that we can use this kind of simulation, we started to research about emotion. In the first study about emotion, we measure achievement emotion in one-round simulation. So we use a questionnaire to measure that, and we assessed performance as well. And what we found, a difference from the first study, in this study, students performed well, and they reported more positive than negative emotion. They report happiness, pride, and joy, but moderate level of anxiety, a low level of shame and frustration. Students felt proud because they could demonstrate in a complex simulation that they have learned so far. And this encouraged the further study and motivation. But also, moderate levels of anxiety were seen as a promoter of learning because they say that this allows them be aware about their learning needs. However, shame and frustration were seen as a factor, as emotion that can be detrimental for learning because affect their self-esteem as well as the motivation. We couldn't find significant correlation between emotion and performance, but we can say that placing undergraduate medical students in a complex simulation that they can handle raise mainly positive emotion that seems to contribute to learning and motivation. After that, we knew that a student can experience a range of positive and negative emotion, but we wanted to know and explore in a deep way what happened with emotion, but during simulation itself, in the moment. So for that reason, we designed a phenomenological study in where students wore video glasses and we record the one-round simulation experience in a first-person perspective. And then we use that recording to elicit interviews and talk about what happened and what they felt in that moment. And what we found, this was like a Collie roster ride, because students felt emotions that are positive, then negative, that they are fluctuating during the simulation, and according to their performance in the scenario. we could identify forming themes. Prior to the simulation itself, they feel fear, anxiety, uncertainty, because they don't know what will happen in the simulation and how they will perform in that setting. This is nervous anticipation that you can see there. But after the entrance to simulation room, shock and awe. So they felt so overwhelmed because they could see a lot of things happening at the same time, and they felt anxiety as well. But when they start to performing and interacting with patients, start this roller coaster ride. They feel positive emotion like a satisfaction, for example, when they see that the patient improved the clinical situation because of the intervention, but when they experience failure, they perceive more negative emotion because and fear to be judged as incompetent. And finally, safe landing is with a question mark there because that represents the debriefing. Whilst debriefing aims to encourage more positive emotion in students, negative emotions can persist even with the debriefing. So we can say that complex simulation can evoke intense emotion in learning. If a student experience a good progression, they perceive more positive emotions, and that are seen as have a positive impact on learning, but they experience failure, more negative emotion comes, and which made them question about their future performance. And after to know that, the amount of intense emotion that the student can experience, it's so important to know what happened with the facilitators, how they work with that. How are they able to recognize those emotions, what they do, and why? This was the last study. So we found that facilitators are able to recognize emotion, positive and negative emotion for different cues. And we identify 3 different situations or patterns of profiles of facilitators. One group of facilitators say that they are able to recognize emotion and they modify the simulation and unfold the simulation in order to dampen negative emotion to preserve learning. Other group of facilitators say that they are able to recognize mainly negative emotion, but they argue that it's better let them feel the heat to prepare for practice, because in the real clinical world, doctors face a lot of negative emotions. And also when they detect positive emotion, can also increase the challenges of the simulation in order to push them to the limit of their competences. And the final group of facilitators, they are able to recognize positive and negative emotion, but let the simulation run as planned for all learners for the same conditions, and then address the emotional responses during debriefing. So how these facilitators react to or not to the students' emotion is a complex process. It's driven mainly for their beliefs about how emotion can influence learning, and such beliefs are shaped by the personal experience as a doctor and as a teacher. So as a final conclusion of my work, I can say that war-round simulation can offer meaningful opportunities for the students to improve their war-round skills. War-round can evoke intense emotion in learning. Those emotions can be fragile, dynamic, and related to the perception of the performance in the war-round simulation scenario. That positive and negative emotion can promote and hinder learning, but the strong negative emotion can be a more detrimental effect on learning. And facilitators have the agency to react or not to students' emotions in order to optimize learning. Thank you very much. Muchas gracias.
Well, thank you for this presentation. And we'll now go to the actual defense, and the first question will be asked by the chair of your assessment committee, Professor Teunissen. Pim Teunissen is a professor of work-based learning in healthcare in Maastricht University.
Thank you, Pro-Rector. First of all, I had many positive emotions when reading your thesis, and there were good reasons for that. I really enjoyed the thesis, first of all, because of its topic. Emotions are something that is very important in education, yet we don't see a lot of research on this topic. So to see that in your thesis and combined with the setting of simulation was a very interesting combination that I learned a lot from. Next to that, you studied it from different perspectives and you used different methods, some very innovative ones like video classes for phenomenological research. So I want to congratulate on this book. And you did a great job, and that's also, I'm sure, because of your wonderful theme, so congratulations to them as well. Now the obvious starting question would be, what are your emotions in the moment? I will not do that.
Yes, a lot.
I can guess. But it is clear, and that's also what you just explained in your presentation, that emotions, whether they are labeled as positive or negative, they have an effect on learning, and they can also have an effect on performance. But my first question to you is really about the effect of emotions on learning. Based on your work, can you explain to me what a good balance would be in terms of emotions and their effect on learning?
Okay, thank you very much, highly esteemed opponent, for your question. And now I'm going to answer. Emotions, from the knowledge from the neuro and cognitive science, seems to say that emotion can modulate perception, memory, reasoning, and the capability to transfer information to new situations. So taking this in account is so important to be able to be aware of students' emotion in order to optimize learning. So how to balance and how is the sweet point of learning? We know that it's a little difficult. We are it's growing the interest in emotion in simulation, in instructional design, because we know that positive emotion and also negative emotion can promote learning. For example, anxiety. You can find some other studies in which say that anxiety could be associated with poor performance or cognitive load, increase the cognitive load. But students say that anxiety is good for them because they say, I can realize that I am not fully prepared to deal with that. I need to study more. So there are some emotion there are also positive emotion that can be negative for learning. Not just it's positive, because, for example, a positive emotion like relaxation that is deactivating emotion with low level of psychological arousal can produce disconnection from the activity and learning. So, in my opinion, it's so important to know who are our students, because every student will experience this kind of teaching method as a simulation in a different way, and they can feel different things. But we know that strong negative emotion can have a detrimental effect on learning. For example, when you see during the simulation students who are experiencing strong negative emotion, like, for example, despair, they say that it's not possible to think. They become to be paralyzed, and the clinical process, the clinical thinking process is stopped. And sometimes they say, my mind is blocked, I am blocked. So
I'm going to, sorry, interrupt, because I'd really like to get some advice from you. because next to my role as a researcher, I also work in the hospital as a gynecologist, and I'm a clinical supervisor, sometimes in simulation settings, but more often in real settings. And I get feedback from my learners, and they sometimes say that they think I'm a bit scary. Because they say what they want to do, and I don't say that's okay or not okay, but I ask why. And they explain something, and I ask why, and I keep asking why, and they find it hard to read what I mean. Or they think that I have an opinion about them, but I'm not telling them my opinion. So I don't want my learners to be scared. I also don't want them to be on a routine mode of working and just do what they think they should do without thinking about it. So how can I understand what my individual learner needs in terms of optimal state of emotions to help them develop?
Okay, I think that the first thing is to know who is your student.
It's women,
Yeah,
women
this is
usually.
important to have
female residents.
Yeah, and I think that it's important to reflect on that and talk with my students about how emotion can influence learning, and if they are feeling some positive emotion because they are reaching diagnosis or making good plans and everything is okay, this could be a good thing to reinforce the further study and motivation. But when you see that that when you discuss with your students about failure, for example, you can see when the student is experiencing strong negative emotions, they are so focused on the error. And this is valid not just for simulation or debriefing. In the clinical case, in the clinical practice, it's the same. When your student is so focused on the error, is not able to see the whole picture of the clinical case. So probably the learning will be limited. So I think that it's important to read this emotional tone, and when you see that the student is affecting their performance, we know that the performance is not the same as learning, but when you see that the performance is being affecting, and it's important to talk with him and see what is he or she feeling, and how that kind of emotion can impact their learning in order to balance. Because the sweet point when a negative emotion could be positive for learning or negative for learning is not clear.
Is there time for one short question?
I'm afraid you'll have to stop here.
We'll have plenty of time afterwards. Thank you very much for your clear answers.
Thank you.
Thank you, Professor Teunissen. And that's because I now want to give the floor to an online guest, and it's Professor Verder Schelen. He's a professor of innovation of care and education at the Free University in Amsterdam. We are always happy to have guests from other universities because it attests to the importance of the work. Professor Schelen.
Thank you, Mr. Rector. Dear candidate, it was a joy to read your book. And I think that I learned a lot while reading it. And I'm very interested in this issue that you were studying, emotion and learning, because I really feel that emotion is so often really important. Also during daily life, I'm also a gynecologist. I'm doing obstetrics, and it's all emotion and reflection and learning. Reading your book, I had a lot of flashbacks and so on, but once more, my congratulations on the work, and also to your team. That's always great to see this kind of teamwork. I'm a great fan of the fact that people try to do mixed methods, as you have done also. So doing the qualitative work, which reveals a lot of in-depth questions and gives a lot of insight, and together with measuring and trying to make correlations. And in chapter 3, I could see that you try to correlate between emotion and performing during the workaround simulation. You could not find no correlation at that moment, and you explained that by a high performance score. So I thought, well, this is an ideal environment to have a closer look at correlations, or let's say quantitative ways of finding the relation between emotion and performance, and even more learning. So I was looking at your future research in the general discussion, but most of your questions you raised were again of qualitative nature, which I really love. But I thought maybe we could fit in some quantitative study that you could add to your work. And I was wondering that you think of some ideas how to use this simulation setting, which is relatively controlled, to design a study in which you can quantify the relation between certain emotions and performance and learning. So can you tell me a bit about your thoughts?
Okay, thank you very much, highly esteemed opponent, for your question. And in the first studies, when I started to work with this, I was interested in quantitative measure about and see how this can relate about emotion and performance. But when I was moving on in my research, I can say that simulation is more, the most important thing is what the students think about learning and how they can perceive the impact of your intervention as an educator on the learning. So I really was thinking in another study, not just in continuity with the line of quantitative research. It's more qualitative again, because in the study number 3, we could know the amount of emotion that the student can perceive in complex simulation and how they perceive that they can impact on learning. And then the number 4 about facilitators, and we could see that facilitators, they see that they are able to recognize emotions, but it's a match between that student is feeling and the facilitator is recognizing. We don't know. Maybe it's a perception that the facilitator have shaped by beliefs, assumptions, or personal experience. But I think that my future research will be confronting these two situations, maybe again with a phenomenological study. Why not using video glasses, but both students and facilitators, and then to talk a conversation between them. What do you feel here, and how you are able to recognize is a match or not? And on the other hand, the different actions that you can do to modify the simulation in order to optimize learning is okay for the students or not? So I think that
I can hear that you have some very interesting ideas about how to go further in depth in a qualitative way. My worry is a bit, I was reading through all the studies, and negative emotion was often mentioned as something that really you should take care that it does not hinder learning. And that gave me the flashback of my own training. I come from a what you could call a repressive training. So what we got was a lot of negative feedback and, well, let's say a lot of negative emotion. And, well, most people working in that ward were kind of fighting the idea of getting to be a doctor that should get negative feedback. So we were working really hard to learn and study and so on. So that gave me the feeling that some measurement to make sure that it is not a culture in which we cherish our children, no negative feedback, only positive feedback. And that goes on to the students and to the residents. Is that useful? And then I feel maybe we should make sure that this mixed message or some quantitative proof might be necessary, not to get in the trap of groupthink. What do you think about it?
Okay. Yes, I think that could be a possibility. And we haven't been present that for some people, a strong negative emotion could be a strong external motivation for learning, but not for all. But I think that it is possible to do an other study using mixing method and measure maybe. I'm not sure if in this complex simulation, like our own simulation, but we can design a scenario where we can measure in a more simple way performance and measure emotion again, and then complement that with qualitative data as well. Thank you very much.
Sounds good. Thank you very much. I give the word back to the rector.
Professor Schelen. I now turn to another guest, Dr. Tobias Boerboom, is the Policy Director of the Educational Center of the Veterinary Medical Center in Utrecht.
Thank you. Dear candidate, first of all, I would like to congratulate you and your team on this result, because you have poked some big new holes in the black box of simulation training. And as simulation training is here to stay in medical education, I'm sure that your thesis will inform and inspire new and existing initiatives in this field. And also within veterinary education, simulation training is becoming more and more important. And there's a need for being able to train complex clinical situations in our field of work, mostly also because we want to reduce the use of animals in our education. That's why I'm grateful I am able to discuss your work in more detail with you. But maybe first a small question at this point of this ceremony: if I have to throw a life jacket, or you can still bear the heat. And maybe you can give a short answer, then I will choose my question. You can.
Sorry, can you repeat the question?
I'm sure in your chapter 5, you would the persona could choose to throw a life jacket, or you can still bear the heat.
Yes.
Yeah, you can.
Yeah, I can explain a little more what happened.
No, that's not necessary. I think you can still bear the heat, and I will go to my question. One of your conclusions of chapter 2 was that simulation impairs learning, that distraction could impair learning. And on the other hand, dealing with interruptions is a part of the postgraduate ward-round simulation tool you used. And it was used to measure the performance. And I presumed that distractions are a fantastic learning opportunity instead of an impairing factor. But maybe you can explain how that contradiction works.
Okay. The medical students rotate with emergency ward as a clinical practice. But when they are in that setting, students say that they are more observer of what happened and how doctors make decisions or deal with this kind of interaction. But then when they are in the simulation setting and they were exposed to this kind of factors during war-round simulation, they say that it was the first time that they could deal with that as a doctor in charge of the shift. And so they said that this could impair learning because they can be disconcentrated from the mainly activities or the clinical care because they receive a phone call or a relative ask for something, but they say that they need to be trained to deal with that because in the real world they don't have that opportunity.
No, we're always distracted in the real world. But, but how can we learn them to deal with distractions?
For example, during the debriefing, when we start to discuss and reflect on what happened, they could be realized that in this emergency situation, they need to be focused in prioritization criteria. And this is the first time that they are applying prioritization criteria by themselves. And probably, although you have a lot of things to do, multitasking activities, it's important to see what of those activities are the most important. And what activity you have to be with your complete attention and solve that problem because could be a life-threatening condition. And a distraction maybe can wait 2, 3, 5 minutes and nothing will happen.
Okay.
So we reflect on that during the briefing.
Okay, thank you for that answer.
Yeah.
What struck me, and that's something you said in your answer, is about students being passive observers while being in their internships. And what surprised me was that the simulation training was programmed in the last year of the curriculum. Am I right?
The war-on simulation training, yes.
In the last
but they
year,
have a medical curriculum based on simulation.
Yeah, and you also wrote in your thesis that some participants felt quite prepared for the clinical work then. And what I was asking myself is, could it help if we programmed simulation training somewhat earlier in the curriculum so that they would be more able to do their clinical work during the internships and they wouldn't be passive observers?
Okay. Steam Happonen, thank you for your question. And I can say that although they have simulation training across the medical curriculum, this kind of complex simulation, such as war-round simulation, has important and specific learning goals that are not managing a patient with X disease. It's not about how to reach the diagnosis or how to can do a good management plan. It's about how to deal with multitasking activities and how you can prioritize, how you can make decisions with partial information under pressure, with time constraints. So they are exposed of this kind of simulation before, but single simulation, individuals, patients, but this kind of complex simulation in where they have to interact with a lot of factors at the same time, we start to do in the last year of medical training, but also maybe could be a good idea to prove to do this something, maybe 6th year of medical training, because for us it's 7 years, and 6 years, and measure if they can handle or not with this kind of scenarios.
Okay, thank you. I think I give the floor back to the director.
Yes, thank you. Time is short, of course. The secretary of the degree committee is Professor Mirjam Auer-Egberink, and she's a professor of implementation of educational innovations at our university.
First of all, I also would like to congratulate you and your supervisors with your studies and your thesis. I've read it with great interest, and I also admire the way that you combine different methodologies, novel methodologies, so very interesting. And I think research on emotions of students and the relation with learning is relevant, important, but also difficult. My first question to you is quite a general one. In your studies, you measured performance and learning.
Sorry.
Performance and learning.
Okay.
The first in a quantitative way and the second in a qualitative way based on the perceptions of students. And at some occasions when reading your thesis, I got the impression that the two were mixed up a little bit. So maybe you could first provide me with the definitions of the two concepts, so performance and learning, because obviously they are not the same, as you already stated. Yeah.
Yes. Thank you, highly esteemed opponent, for your question. You're right, it's not the same.
No.
We can observe performance during the simulation itself, but we know that performance doesn't mirror learning, because we can have a low performance and great learning, and but good performance and nothing of learning. So in here we measure performance. We know that it's not the same as learning, and is the perceived impact on learning. So more research is needed to see the effect of this kind of simulation on learning, and I think that is one of the study that I could do in the future in order to see learning
So
properly.
whether learning leads to better performance.
Yes.
That's obviously
Yes.
what is interesting. Although I agree with you that good learning doesn't automatically lead to good performance. So let me indicate where my confusion stems from. Especially in chapter 2 of your thesis, you measured in a quantitative way that there is no statistically significant relation between cognitive load and performance. And in the interview, students indicated that distractions and noise, which leads to extraneous cognitive load, do impair learning. The confusing part is then that you conclude, for example, on page 30 in the practice points, that distractions and noise interfere with performance. So there I got lost a little bit, because that's not in agreement with your quantitative measurements, but seems to come from the qualitative finding that it does interfere with learning. So can you explain where this conclusion comes from?
Okay, this complex learning environment with noise, distraction, medical equipment, and the simulation venue, we thought that will be difficult for students to handle and could increase the cognitive load. Mm-hmm. But we didn't find like that. No. Maybe that could be explained for two different factors. One is that the clinical environment can contribute more intrinsic cognitive load, because could have important piece of information that a student needs to pick in order to solve the clinical cases. But the other is that the questionnaire doesn't capture the extraneous cognitive load in simulation. Because if you
questionnaire on cognitive load?
Yes, yes. So 90% of students rate the questions about extraneous cognitive load with 1.5 or less out of 10. Very low. Yeah. But when they are asking about that, they see, oh yes, the interaction was so difficult to manage. So we can find a gap there between the instrument to measure that and what they are feeling or what they are perceiving, the impact of these kind of things.
So would you use this questionnaire again when you are interested in cognitive load? No? No. That's your conclusion.
Definitely
here.
No.
Yeah, okay. Then later on in your thesis, you state that students that experienced failure in this complex simulation situation could get strong negative emotions, and they even could question their future performance. Yeah. So, well, that's serious, I would say. How often did that happen?
It was like third part of my students in this study. Third part of my students in this study say that. Yeah. Because they felt strong negative emotions, shame, disappointment, and shame of their performance and despair. They get blocked, and they say, if something like that happened to me now, in a protect and safe environment.
Yeah.
How I am going to do this when the
In reality.
real practice will be more difficult.
Yeah, yeah.
So,
So when 1/3 of your students experience things like that, is that not a risk of dropout of your studies? And do you have sorrow about that? Is that a reason for concern?
yeah, I concern about that
Yeah.
because if you can see, our students feel sometimes the simulation and the debriefing more like a judgmental experience than supportive experience.
Yeah.
So I think that is so important and necessary
Yeah.
to include this kind of topics in development programs for facilitators in order that they can know the effects that emotion can have on learning.
Yeah. And I assume that you would like to prevent the dropout.
Yeah. Yeah.
And maybe see cause
Yeah.
to change a little bit.
Yes.
Yeah.
Yes.
Okay, I see the rector looking at me, so I'll give back the word to him.
It's a matter of feedback. The next question will be asked by Dr. Boukje Kompen, and she is an assistant professor at our Department of Educational Research and Development.
Dear candidate, felicidades
Thank you.
to you, as well as to your supervisory team for writing a highly relevant and coherent thesis that has been a pleasure to read. As the others also mentioned, I really appreciate the variety as well as the originality of the methods and methodologies that you have used. And I also think you did a great job in combining the insights from the different chapters into overarching conclusions and implications for practice. My first question relates to chapter 5, in which you have interviewed simulation instructors to learn how they identify and respond to students' emotions. And based on patterns in the data, you eventually describe 3 profiles of facilitators. And they differ, among other factors, in the extent to which they feel students' emotions should be attended to, either during or after the simulation. And I am wondering if, based on what you have learned in your research, if you could say something about which profile you think is preferable for student learning.
Okay. Esteemed opponent, thank you for your question. It's a difficult question because it's not a specific response. I think it's not unique response for your question because it will depend on the person. For example, for me, I may be the same that the opponent. Negative emotion could be strong external motivation for further study, but for others not. So it's difficult to say what should you do or what I am going to recommend for all facilitators to do in that situation. But I can say that it's so important to read the emotional tone, be aware about students are experience a lot of emotions, positive or negative, and be aware of the small cues maybe that the student can present during simulation in order to try to understand what happened. But if student is perceiving strong negative emotion, you can see that the student can move on doing simulation and can say that it's better to give some life jacket in order and modify the unfolding simulation in order to preserve learning. Because if you don't do anything, probably this student will lose the possibility to learn something. So we can have different small strategies that can help you to dump those negative emotions, like, for example, reduce the pace of simulation, give them students more time to think and take the control of the simulation, for example.
Okay, I'm going to ask you to hold that thought because it also relates to my second question. So you conclude in the discussion section of your thesis that faculty development programs should support facilitators, and I quote, to recognize intense emotions experienced by learners, as this may allow them to modify aspects of the simulation to optimize learning. So that summarizes also, I think, what you just said. But I can imagine that not all facilitators are equally capable of, or willing even, to develop this competency. And as you also acknowledged in your thesis as well as in your presentation, you say emotions are very personal and dynamic, and they are fragile and can be difficult to predict. So that seems to imply that there might also not be a one-size-fits-all approach that teachers can use. And that's also what you just said, I guess. So if we take all these aspects into consideration, could you share some ideas that you would have for faculty development? So how should facilitators be prepared, according to you?
Okay. Esteemed opponent, thank you for your question. I think that the most important thing that my work stress the need that facilitators recognize emotion. This is the first thing, because we can see in my studies that facilitators react or not based on beliefs. So when you are in training to do after stimulation, emotions are part of the training, but just in the debriefing. And you are trained to explore emotion during debriefing, but nothing else. And as a facilitators, we don't know what are the effects of emotions on learning. So I think that the first thing that I would like to do is that facilitators be aware of emotions can influence learning. So I definitely, I will include in the staff development programs the role of emotion in simulation. It's important that facilitators know the effect that positive and negative emotion can have on performance or learning, but also that the action that they do or not also can have an important effect on learner. So if I reduce the intense negative emotion, can have a positive or maybe a negative effect in these students. But another thing is, I think that it's important to reinforce that debriefing should be more supportive, and simulation should be more a supportive experience, more than judgmental, because I was a little surprised with that result, because I wasn't sure that something like that was happening, and why students are feeling that. So I think that in this kind of program, we should highlight the importance that this experiential learning must be supportive more than judgmental experience.
Thank you very much.
Thank you. And then probably the last opponent is Dr. Jill Whittingham, educational psychologist at the Department of Educational Research and Development.
Thank you very much. Well, first and foremost, dear Claudia, I would like to join the congratulations of my colleagues and congratulate you on reaching this magnificent milestone. Also, congratulations to the team accompanying you on that journey. As an educational psychologist, I was highly interested to read more about the effect of emotions on learning. More specifically, you elaborate in your thesis that emotions have all sorts of impact, depending, of course, on what the emotion is, but they could modulate perception, affect reasoning, attention, memory, and transfer of learning, just to name a few. Ideally, I would like to have a doctor by my bedside who can conquer all of those things. So I think training is essential. That leaves me to my question, and I would like to focus on chapter 5, and more specifically, I would like for you to read, if you don't mind, the very last sentence on page 97. Could you read it out loud for us, please? Do you have your thesis with you?
Yes,
no
I don't
worries.
have
Then
it.
I will. Yeah? Yeah. The very last sentence, yes.
Yeah. Our film provide a foundation to guide education. That part.
In mine, it says, don't worry, I'll read it out loud. In my, it says, like dancing, the aim to work in harmony with students is to achieve the best dance student learning. I was very interested in that link you make with dancing and learning, and that's something I would like to elaborate on.
Okay. Okay.
So, if we think of learning is like a dance, where a teacher and the students, they are partners on the floor. Which reminded me of the movie Take the Lead. Don't know if you don't know the movie, that doesn't matter. In this dance movie, a talented teacher, being the actor by Antonio Banderas, might know him, he takes a group of students from diverse backgrounds and transfers them into a harmonious team on the dance floor. We'll discuss on the role of Antonio later during the reception. But for now, that made me think of the framework of cognitive apprenticeship. That approach in medical education formulates key components for students to be able to learn in an authentic setting. In this case, a ward setting. It unfolds components like modeling, scaffolding, and reflection. Structured activities that help students guide their learning and which is provided by the teacher. So, just like in this case, dancing, a student needs to learn the cognitive processes and strategies demonstrated by that teacher. And the reason why I'm reiterating those different roles again is because I come to the question now is, who is in the lead in this process? Is it the student who sets the pace, taking potential emotions into account, or is it the teacher who is the expert, who knows all about the different steps, the different instructions, knows what to do, deal with audience and whatnot? Could you elaborate on this?
Okay. Thank you, esteemed opponent, for your question. It's a difficult question. And I can say that I think that it's a responsibility of sharing for both. It's not just the student, because the facilitator is the expert on the field, but it's not just facilitator, because this is a experiential learning. And we, as a facilitators, need to be aware about the needs, that student needs, and be supportive with that. So I think that this dancing should be between two persons who is interacting, connecting, knowing each other. And in that way, as a facilitator, we can give a more supportive element to our students, and on the other hand, arrive to our primary goal, that is that student learn. So I think that is both.
So if I were to really force you to make a choice, who would be in the lead, the student or the teacher, in your opinion?
Sorry, can you repeat?
If I force you to make a choice, who is in the lead, the student or the teacher, what would your answer be?
Student.
Student?
Yeah.
Okay,
yeah.
Good, that's fine. Am I allowed a very big question? Because you've very well elaborated and showed us different examples in a ward context, which I think is very...
You have to be short.
Yeah, that's fine. Do you have other contexts in curricula where you feel, aside of, for example, the wards, where students' emotions could play a role?
Okay, thank you for your question. I haven't researched other contexts. I was focusing complex simulation, but I think that the answer is yes. It's not just in this context.
You may finish your answer. Short, please.
Okay. So I think that is emotional. It's part of the life. So in every teaching session or experience, you will feel emotions. So it's applicable.
Thank you very much.
Well, thank you, Dr. Whittingham. Claudia Behrens Pérez. The time appointed for the defense of your thesis has now passed, and that implies that the committee will withdraw to discuss the quality of your defense and of the thesis. And I would like you to await the results of those deliberations in this room, and then we will return. Okay. And therefore, I adjourn.
Thank you.
The PhD defense has now ended. The degree committee will debate the candidate's performance behind closed doors. This process usually takes about 10 minutes.
Long road to the south side. 10 miles in my rearview mirror, I know what it felt like. My goal's only getting clearer, east side to the west side. No place like home, if it's questions that you've got, go the extra mile and die. On the line, I know you know that I can't read your mind. Years can't fly by now, don't waste all your time. Cause I'll go the extra mile. Long road to the south side, 10 miles in my rearview mirror, I know what it felt like. My goal's only getting clearer, east side to the west side. No place like home, if it's questions that you've got, go the extra mile and die. On the dash, got my laces tied. Long road, I don't waste no time. Break rules because fate decides. With the team and we chase the light. I make a move, fall down, shake it off. I hate to lose, bad branch, break it off. No room for negativity, praise and love. Prepare for deep part cause we're taking off. Get the mileage, traveling so far from home. Gathering knowledge, other connections. I put the time in to get everything I ever hoped for. It's a challenge and we all in. It's a better future that we go for. And even though these nights seem long, I know that I am never on my own. Know you won the battle once you grow. South side, 10 miles in my rearview mirror, I know what it felt like. My goal's only getting clearer, east side to the west side. No place like home, if it's questions that you've got, go the extra mile and die. Long road to the south side, 10 miles in my rearview mirror, I know what it felt like. My goal's only getting clearer, east side to the west side. No place like home, if it's questions that you've got, go the extra mile and die. Years can't fly by now, don't waste all your time. Cause I'll go the extra mile.
Claudia Behrens Pérez. The degree committee, here present, has assessed the quality of the thesis and the defense you just gave. And in view of its positive verdict, and taking into account, of course, your previous qualifications, the committee has decided to grant you the degree of doctor. Professor Dolmans is authorized to confer upon you this academic distinction in accordance with Dutch University custom. I invite you to take the floor.
First, I have to ask you a question or a promise. Do you promise to work in accordance with the principles of scientific integrity at all times?
Yes, I promise.
So to be careful and honest, transparent, independent, and responsible.
Yes, I promise.
Okay, so body authority vested in us by law and in conformity with the decision of the committee here present, I hereby confer upon you, Claudia Cecilia Behrens Pérez, the degree of doctor and grant you all rights attached by custom and law. And as evidence of this, I now present you with the degree certificate signed by the rector, the secretary, and the other members of the committee, and affixed with the official seal of the university.
Thank you very much.
Dear Claudia, on behalf of your supervisors, we'd like to extend to you our warmest and heartfelt congratulations.
Thank you.
You have really no idea how I, Diana, and Eric feel so proud for you today. Today we gather to celebrate a remarkable individual whose journey exemplifies the essence of academic pursuit, perseverance, and dedication, and it's with immense pleasure and pride that we honour you, Claudia, today as you receive your doctorate degree from the School of Health Professions Education at Maastricht University. Your academic career has been nothing short of remarkable, reflecting not only your intellect, but also your profound commitment to advancing knowledge in the field of simulation-based education. Over 10 years ago, you embarked on your journey of your PhD. And I think it's safe to say it wasn't a conventional journey. And whilst conducting your research, you had to balance many demands on your time. Being a mother, being a wife, a busy clinician, and also developing the simulation centre within your home institution. And also looking after all your dogs and Chile and your horses. A very busy individual. But if that wasn't enough, many other life events came your way through the 10 years, navigating illness, political unrest in your country, the pandemic, building of a new simulation centre in the accreditation process. My word, that's what an achievement over the 10 years. Oh yes, and the odd earthquake as well. I remember having our meetings online and seeing your screen shake. And I said, Claudia, are you okay? Yeah, that's an earthquake. Anyway, can we talk about my analysis? Wow, really humble. So, in the face of all these challenges, Claudia, your unwavering determination, courage, has been nothing short of inspirational to us all, and always met with a smile. Despite the obstacles you encountered, you remained steadfast in your pursuit of knowledge, demonstrating a remarkable resilience that serves as a beacon of inspiration to us all. Your work unravels some of the important mysteries regarding emotions and experiential learning and simulation and their impact on learning. Simulation can be a really powerful form of learning, but from your work we know that it can evoke really intense emotions in learners. Whilst many of these emotions can enable learning, they can also hinder learning and at worst cause distress. Given that educators have the ability to modify simulation and the conditions in simulation, it's really important we understand this fragile dance between emotions between you and the learners and the facilitators within simulation. Importantly, we know from your work that often learners will conceal their true emotions, so we need to unlock that. We need to bring that to the surface, and your work guides us in that process. Moreover, your work enlightens how facilitators can become aware of these emotions and how they react to them. Such insights opens up really many lines of inquiry on how best we can guide educators to optimize learning in simulation. As a practitioner in the field of simulation, I'd like to thank you for this new knowledge that you've introduced to our field and influence our practice on a day-to-day basis. Behind every successful scholar, there stands a supportive network of mentors, colleagues, family and friends who have nurtured you and supported you through this 10 years in your academic journey. I'd like to extend our heartfelt gratitude to all those individuals who've played an important role in guidance for you along the way. So, in conclusion, I invite you all to join me in congratulating Claudia on this momentous achievement. May your journey inspire us to embrace curiosity, pursue excellence, and make meaningful contributions to the field of health profession education. Whilst your PhD journey ends today, you firmly begin your journey as an independent scholar in the field of simulation-based research. Felicitations, Claudia.
Thank you.
And then Dr. Behrens Pérez. It's my pleasure to congratulate you on behalf of the academic community in Maastricht. And I extend that also to your husband and children, now in Disneyland, as I understood. Other family, maybe they are also in Disneyland, and friends, and they seem to have suffered over those 10 years, at least that's what you say in your acknowledgement, so they will be relieved, and I saw some relief, a positive emotion, or maybe sometimes a bit negative as well, when Professor Dolmans was saying the phrases, but I saw you smiling, and indeed you were smiling all through the ceremony. I also congratulate the supervisory team, of course. Thank you for the work that you've done. I congratulate the school the School for Health Education of our university. It has been a productive trajectory as well. I saw that all the chapters have been published or are almost published in revision, so that'll be okay in the end, of course. So I congratulate you on that too. And of course, the doctorate is also the stepping stone to more research, as research is the stepping stone to more research after it. Then, finally, I would like to thank the opponents, especially those who came from afar or who are here online. Professor Schele and Dr. Boerboom, thank you for being here. I would ask Professor Schele to stay online for a while, but now I will close the ceremony and then the recording will be stopped and we will address you in private.
Thank you.
All right, please.
Yeah.
Recording stopped.
First we'll make a photograph and
Okay.
you could stand there. Yeah, normally we give it to the